Hello, my name is Mike Sanders. I'm the founder of ExecuCare Addiction Recovery Center. At ExecuCare, we offer a non-traditional solution to a very traditional problem.
Neurotransmitter restoration really is basically repairing the damaged receptors that have been damaged due to addiction over a prolonged period of time. Essentially what we're dealing with here are taking a proper solution of amino acids and repairing damaged neural receptors.
It's estimated that 10% of the population, perhaps 30 million people, suffer from addiction. Yet less than 10% ever seek help and get the treatment needed. Research indicates that addiction costs American corporations over $200 billion per year, just in lost productivity alone. This does not include the higher health cost and potential loss of life. Let me assure you that addiction does not discriminate. It does not know the difference between the boardroom and the shop floor. Corporations have addressed this problem with the development of employee assistance programs, EAPs as they're called. In fact, approximately 2/3 of the corporations today have access to EAPs. However, the national utilization rate of these programs is reported at less than 7%. The most recent national survey found that 4 in 5 employees stated that they would not call their EAP even if they had an addiction issue. The reasons stated were negative stigma, fear of losing their job, and treatment options available. Most people don't have 30, 60, or even 90 days necessary to get the help needed. This is why ExecuCare offers a valuable alternative to traditional treatment. You see, traditional treatment addresses the psychological, the behavioral, and the spiritual aspects of the disease of addiction, but leaves the healing of the brain up to time and chance.
I've had experience with addicted patients throughout my 30-year career, and they are the most difficult patients to treat in any practice. Their thinking is never clear. Even when they are switched to alternative drugs like Suboxone or Methadone, in my experience, they never really clear up and get back to normal. Whereas with this treatment, after the 10 days, they're off drugs and they're thinking clearly. Their emotional state is markedly improved, if not back to baseline. And then they can get into the second phase of their recovery, which is to not return to those drugs of abuse.
At ExecuCare, we put the healing of the brain first. We help individuals discontinue the use of drugs and alcohol while repairing the damage done to the brain as a result of chronic use. We do so in only 10 days on an outpatient basis, leaving a person free of drugs, free of the cravings to use drugs or alcohol, and more cognitively ready to make the lifestyle changes necessary for a productive life in recovery.
I've worked with nearly 25 of ExecuCare's clients, and most often I've seen these clients on day 2 or 3 and on day 8 or 10, and sometimes in between. The difference between day 1 and day 10 is astounding.
ExecuCare uses an all-natural medical nutritional therapy consisting of amino acids, minerals, and vitamins. The IV protocol is administered by an RN under a doctor's orders.
Essentially, it's an intravenous food, just like dextrose in water or any other IV that would be administered in a medical setting. The difference is the ratios are strategized to optimize a particular set of neurons, and it seems to work very well.
Each client is assessed pre-treatment by our physician with a physical, history, and lab work, and a protocol is designed based on that individual's chemical survey to ensure all damaged receptors in the brain are addressed. Each protocol consists of the necessary USP-grade nutrients needed to induce damaged receptors in the brain to repair.
We can study this pretty well, and we understand it very well. Doing something about it has been the challenge, because these receptors control so many functions in the body that that's why all addicted individuals are going to have a change in behavior that's usually negative because their brain is being affected by these drugs. They're not usually even aware of how badly those changes have affected their behavior until they're looking back in retrospect and hindsight.
At ExecuCare, in particular, is they take the time, the effort, and do the research to get, based on each individual client, to assure that each individual client is getting the best possible follow-up care, whether it's going into a residential facility, going into some kind of halfway program, whether it's 12 steps, Celebrate Recovery, whether it's utilizing one of us as individual therapists. On a case-by-case basis, this is taken care of by the ExecuCare team. I don't know of another place in the world that you can get that.
If you or someone you care about suffers from addiction, consider your options. You have to take the first step to break the cycle of addiction. You have choices that can work with your lifestyle. At ExecuCare, we want you to succeed and have the process that can help. Take care of yourself.